Once upon a time, there was a couple named Sarah and David. They were deeply in love and had been married for a little over a years. They had always talked about starting a family, but they had decided to wait a little longer until they were more financially stable. After years of marriage, they decided to celebrate their love and milestone by embarking on a romantic vacation to a snowy forest. As they reached there, they couldn't contain their joy and quickly began to immerse themselves in the beauty that surrounded them. As the sun began its descent, David carried Sarah in his back and began towards their hiding. After years of relentless hard work and the tireless perseverance, they finally make a love. Back in their familiar surroundings, Sarah and David face the reality of their daily routine. The demand of work, household chores, and the responsibility creep back into their lives, gradually eroding the enchantment they felt during their vacations. As the time passes by, they are back to reality and the daily grind, but with a heart full of cherished memory from their unforgettable vacation. One day, while walking on the street, Sarah can't control her urge to urinate and wet her pant. Sarah found herself experiencing an increased frequency of urination far beyond what was considered normal. Sarah couldn't go more than a few minutes without feeling the urgent need to relieve herself. She Googled to find out the solution of her problem. And as she scrolled through the tips and the tricks, she found out these two valuable points. Number 1. Don't drink alcohol. Drinking alcohol will inhibit the release of antidiuretic hormone from the anterior pituitary gland of your brain. This is the hormone that decreases the amount of urine production. As the amount of this hormone production is decreased by the alcohol, your urge and the frequency to urinate will increase. But no, she don't drink alcohol. This reason is not true for her. What next? Number 2. Do Kegel exercises. Kegel exercise is like you pretend to urinate and then holding it. Basically, you relax and tighten the muscle that controls urine flow. As the muscle strength doesn't come overnight or symptom doesn't resolve. As nothing works, he started panicking. David asked his friend about genuine and knowledgeable doctor on YouTube and came across this channel named Thapa Doctor. At first he thought it was just a scam. As he don't have any choice, he decided to leave a comment. Hello doctor, why my wife can't control pee on herself? It has been 2 weeks, please help. As they are a newly married couple, I immediately asked them to check their pregnancy once, and it came out to be positive. Uterus lies immediately behind the urinary bladder. In non-pregnant women, the uterus has 5 to 10 ml capacity, which weight about 60 grams. This weight and the size of the uterus doesn't cause any effect on the urinary bladder, but as you become pregnant, the capacity of the uterus increases by 500 to 900 times and the weight increases up to 1000 grams. And that weight of the uterus put constant pressure on your urinary bladder. This results into the increased urinary frequency. Luckily, these symptoms resolve after 8 weeks of pregnancy. That uterus goes upward into the abdominal cavity, leaving the bladder free. Finally, they get the answer to their health problem and take a good decision to subscribe the channel. They visit their doctor and perform necessary investigations. After a few months, Sarah gave birth to a healthy baby. Subscribe, like and share.